Good afternoon. My name is Kristen Kilcollins, and I will be introducing you to the Flerken-Goose Assay, which is used to test for the reovirus. The reovirus was isolated in late 2017, as pictured to the right. It is a gastrointestinal infection that has symptoms varying from nausea, vomiting, diarrhea, fever, chills, as well as dehydration. The Flerken-Goose screening assay was developed in late 2018. It is a fairly cheap, less invasive screening test than the current diagnostic test that is being used now. It is very easy to use so that training personnel within clinics and hospitals is very easy. It is a lateral flow assay, as you can see pictured to the right. It has a very clear background that'll give you a positive result as well as a control line that will tell you that your internal quality control is working. We performed a population-based sample study on 10,000 people within a small area. The results of this study were a prevalence of 16.3%, sensitivity, which was 91%, specificity of the test was 15.7%, a positive predictive value of 14.9%, and a negative predictive value of 91.5%. To the top of the screen, you will see the table where we were able to calculate our data, so our prevalence, sensitivity, specificity, the PPV, as well as the NPV. So predictive values for this test. The prevalence, which indicates or predicts the percentage of our population with the disease. The sensitivity was the probability of a positive if the patient has the disease. The specificity is the probability of a negative if the patient does not have the disease. The positive predictive value was our probability of a person testing positive who has the disease. And our negative predictive value was the probability of a person testing negative if they do not have the disease. So how do we talk to our patients about getting a screening test that is less invasive of the one that currently is being used to test for the reovirus? The sensitivity of this particular test is 91%, which means that if the patient has the disease, they will test positive for the disease 91% of the time. So the specificity of the test, the patient could be negative, but will have a 15.7% chance of testing negative that would say they do not have the disease. Our positive predictive value is 14.9%, which means that the patient has a 14.9% chance of having the disease if they test positive. So if the patient chooses to have this test, they have a probability of 91.5% of having a negative result if they do not have the disease. So going forward for our patients, the sensitivity of the test is 91%. So if they have the test, they have a 91% chance of testing positive, which are pretty good odds if they have the disease. At this time, I will be taking any additional questions that you have about the Flerken-Goose assay, as well as any further questions about the reovirus. I would like to thank you for your time and appreciate you letting me come in to speak to you about this new assay. Thank you.